right, so moving on, allow me to briefly introduce today's speaker. Kayla Blanchard is a health equity specialist and coordinator for the Otero County Community Health Council. She is currently pursuing a master's degree in clinical mental health counseling at Adler University, blending her background in psychology with a passion for community health to advance health equity and social justice. Her commitment to social justice extends to serving on the board of directors for Bold Futures, an organization leading policy change, research, and community organizing for women and people of color in New Mexico. She's also involved with Vot-ER, a national nonpartisan initiative to integrate voter registration into the healthcare space, which has empowered her to use her voice to empower others and to empower others to use theirs in the democratic process. She's originally from the Midwest, but she's found a supportive community in New Mexico and cherishes the support of her family, who have built the foundation for who she is as a person. And we also have Dr. Hali Mata, who is a public health specialist who has lived and worked in Southern New Mexico and El Paso, Texas for more than 2 decades. Currently, she teaches at New Mexico State University in the Public Health Sciences and supports the Christus Southern New Mexico Family Medicine Residency Program as faculty in community health. She's grateful to serve as president of the Otero County Community Health Council and as the Southwest Regional Co-Rep and Internship Coordinator for the New Mexico Public Health Association. Holly also enjoys serving as the editorial director for the Health Promotion Practice, supporting practitioners in sharing their advocacy and scholarship to advance health equity. She believes that everyone deserves a voice in the issues and policies that affect their health and well-being across the lifespan. Together, we can ensure that our clinical and community spaces make civic engagement easy, welcoming, and fun. With that said, Kayla and Holly, thank you very much for joining us today, and the floor is yours.
Thank you so much, Mario and Amanda, and thank you so much, everyone, for joining in. Kayla and I are really excited to be with you today. And I've got the code for our Mentimeter interactive piece up on the screen. So if you could all take a moment and either scan the code or go to menti.com and enter the numeric code, then you'll be able to participate from your phones, and we'll get a little input and interaction throughout our presentation. As far as questions, we welcome any and all basically at any time during our talk. So I think we're a small enough group. If you want to come off mute and ask a question, that's fine. We're going to try and pause and check in with everybody. You can also, on your phone, you can join in. There's a little option to open Q&A, and then you can type in a question on your phone, which will be able to make it visible to everyone. Or you can use the Zoom chat. So, and Mario or Amanda, if you wouldn't mind keeping an eye on the Zoom chat for us, that would be great. If somebody has a question, we'll keep an eye on the questions in the that you all use through your phones. And yes, but we're really excited to be with you. And I'm going to pass it to Kayla to get us started.
All right, good afternoon, everybody. Thank you so much for the opportunity to present today. And thank you for the introductions, Mario. So welcome to our presentation. Our 3 main objectives today will be discussing the role primary care physicians play in the improvement of practices, policies, and systems to advance health equity. Next, we'll cover the relationship between civic engagement and health. And lastly, we will identify a few opportunities to collaborate with community-based organizations in your region. Next slide, please. All right, so to begin, I want to ground us in the definition of equity and how it differs from equality. Equity and equality are 2 principles that are often discussed in relation to fairness and justice. Equality refers to the state of being equal, especially in status, rights, and opportunities. It implies that everyone is treated the same, regardless of individual differences or circumstances. In contrast, equity is the quality of being fair or impartial, ensuring that everyone has access to the same opportunities and resources. The CDC defines health equity as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. This definition emphasizes, the importance of addressing systemic inequalities and barriers to ensure that everyone, regardless of their background or circumstances, has the same opportunity to achieve optimal health. So while equality focuses on treating everyone the same, equity focuses on providing resources and support based on individual needs to achieve fairness and justice. So the notion of equity is what guides us in our work with civic health promotion. Next slide, please. All right, so understanding and addressing social determinants of health is crucial for achieving health equity. Social determinants are the conditions in which people are born, grow, live, work, and age, and they play a significant role in shaping health outcomes. Factors such as socioeconomic status, education, employment, social support networks, and access to healthcare services all influence a person's health and well-being. By addressing these factors, we can work towards creating more equitable healthcare systems and improving health outcomes for all individuals. In the clinic and in the community, you are likely aware of disparities in both opportunities and outcomes across all of those domains. These health disparities are symptoms of broader social and economic inequities that are rooted in structural and systemic barriers across sectors, including racism and discrimination. Next slide.
All right, so we're going to pause for a minute here and ask you to chime in with sharing any place you've ever been asked to register to vote. So I'm going to guess DMV will be a common response, but we'd love to hear any and other places that you have been asked, whether it's in a public setting or in a family or work setting, if you've been given the opportunity to register to vote. All right, so we got DMV, County Fair, on a university campus, none. New Mexico Human Services, my doorstep, all right, people going door to door. Community events. Go NMSU. All right, we'll give it just another little bit of time, but thank you for sharing those.
In the
We-
chat.
In the
we also- oh, go ahead, Amanda.
Okay,
In the chat, we also have someone said residency, my roommate, and the DMV.
awesome. Okay, thank you so much, everyone. So we're going to get started, and we'll come back to why it's so important to be asked to vote in a little bit. But just to ground ourselves in why voting is so important and why, as public health and healthcare professionals, we are taking an hour out of our day to focus on talking about voting and our role in promoting civic health. Kayla just talked a lot about social determinants of health. You all address health-related social needs in your practice every day. When we talk about voting, I really like this quote from the author of The Political Determinants of Health, which is, voting is arguably the most important aspect of the political determinants of health. It really is the upstream cause of the causes of the causes. And if you think about issues that matter to you and things that are in your community or your state or nationwide, policies that you are either really in favor of and support, or those that you really feel like that definitely is not a good policy for me or my family or my community. Many of those, if we back upstream, again, they start at the ballot box. So when we talk about the relationship between health and voting, there are literally stacks of research taller than me at global, national, state, and local levels that show a link between voter participation and health outcomes at both the individual and community levels. So the relationship between voting and health is well documented. Within the last couple of years, all of these organizations, including most of our leading public health organizations, many of your leading medical associations, have made specific policy statements, passed resolutions, drafted internal policies, and promoted external policies that recognize voting, not only recognize voting as a social determinant of health, but also encourage physicians and public health professionals, anywhere people work in settings where they interact with community members, to promote civic health and to provide their patients the opportunity to register to vote, to learn more about the voting process, to integrate and to make voting and civic health a key component of services in the healthcare setting. And just as a recent example, and you all, of course, as physicians and medical professionals are far more familiar with what electronic health records and some of these systems within your practices that you use every day. You're much more familiar with them than myself and Kayla. But Epic has now created a specific Vot-ER module that anybody who already uses Epic can just easily integrate into their system, so that just like patients will get text messages or reminders about scheduling a mammogram or a colonoscopy or coming in for immunizations, they'll also be getting a reminder to register to vote or to request an absentee ballot if it's that time of year. So Epic has now seamlessly integrated Vot-ER, which makes it a lot easier on your all's end if you want to take those steps to promote civic health within your practice. The other simple way, which you'll have the opportunity to explore later, is simply through the badges. Some of you likely already have these, like Kayla and I, and there are physicians all over the state who are, regardless of whether their clinic is participating at the organizational level, there's an increasing number of clinicians who are using these badges to just start the conversation, oftentimes at the end of a visit, oftentimes through posters or waiting room slides, to just give people the opportunity to scan a QR code. By entering in their name and address, it takes them directly to their state voter registration portal. So, they don't end up registering to a vote for a third party. You are not doing any voter registration. You're simply providing them with a quick and easy opportunity to think about, oh, hey, I haven't checked my voter registration in a while. I haven't updated it since I moved, or I just used my badge to order my absentee ballot. And now in New Mexico, for those of you who don't know, part of the New Mexico Voting Rights Act, which was adopted last year, is that if you choose to request an absentee ballot, you can now do so permanently. So now when you go to, like when I went to request my absentee ballot last week for the primary elections coming up, I had the opportunity to check a box and become permanently added to the absentee voter list. So every election for which I'm eligible to vote in, I'll automatically get my absentee ballot in the mail rather than having to sign up for an absentee ballot every time. You can add yourself to that list or remove yourself at any time. We got started in Vot-ER. You may be sitting here wondering, what are two non-physicians and non-clinicians doing participating in this national healthcare initiative to incorporate voting into clinical settings? Well, we got interested in Vot-ER when we learned about how easy medical professionals were making it to connect people to resources that would support them in their civic engagement. And then we learned about the annual fellowship they have, which is a 7-month fellowship focused not only on strategies to engage people in voting in whatever setting you work in, but also on the importance of just advocating in general for the people in our communities, whether it's in our practices, in our families, in our neighborhoods, just to make it easy for everybody to have a voice in the issues and policies that matter most to them. So Kayla and I, with our colleague Ursula and our little neighborhood feral cat OG, actually wandered into my house and adopted us the first day of our fellowship meeting. So he kind of became our mascot. A little picture for you cat lovers in the audience. But anyways, we got started in 2022 through this Civic Health Fellowship. And we signed up our health council to be, which was a little bit, we kind of had to call them and say, hey, we're not clinicians, but we are a community health council in Southern New Mexico. And we'd really like to become part of this movement to make voter participation easier for the people that we interact with day in and day out. And they welcomed us. I think it might have helped that we had, we were sort of physician adjacent through my work with the residency program and through our health council's partnerships with hospitals and other community clinics. But basically, just a little background on Vot-ER. They're a national initiative founded in 2021, and they provide structure to support health organizations and health professionals to make it really easy, whether it's, as you can see on your screen, through posters or badges, but to make integrating voter registration and information into clinical settings easy and seamless. It is a nonpartisan, nonprofit initiative, and we emphasize that every time we talk about Vot-ER. This is all about getting people to the polls. It's not about, we don't promote issues, or we don't promote particular issues or particular ways to vote on things. We don't promote particular candidates. It's nonpartisan. We just want people to get the information they need to register to vote. Some of the resources they provide, in addition to, for example, you see our Zoom backgrounds. We didn't make those, they made them for us, and for that we're grateful. But you can get resources like conversation starters. It just kind of guides you in, what if this or what if that? What if my patient isn't really interested in talking about it? You can also track your impact. We'll talk about that a little bit later. They have some really helpful quick 2 or 3 minute training videos, guides on how to use your badge and have productive conversations. And we've just found them really helpful, and they're also adaptable. So, Kayla's done things like integrating our Vot-ER QR code into other health education outreach materials. So if she's at a Day of Hope fair for people who are unhoused and talking to people day in and day out about health council related things, or she's also talking about voting and also talking about the New Mexico Voting Rights Act and encouraging people to get involved through just, again, scanning a QR code and going from there. And you may be thinking like, okay, why is this so important? Why is it so important that we're out there in the community, or that people are out in the community asking people to vote? And it's because we know that there are 72 million people in the United States who are eligible voters, but they're not registered. So among the group of people who were eligible to vote but not registered, 62% responded that they had just never been asked. So again, this was, in response to a need of, okay, there's a lot of people out there who are eligible to vote, but aren't even registered to vote. So it's likely that it's not on their radar screen. They may not be paying attention. And so it's just really important to reach those people. And the reason why we are prioritizing clinical and community settings is, if you look at that population of unregistered but eligible voters, the population groups most disproportionately represented in that group of unregistered eligible voters are young people, people with lower incomes, Hispanic, Native American, Black, and Asian populations. And there's also a lot of overlap between unregistered eligible voters and people most marginalized by our current health system. They're the ones who are ending up sitting in a community health clinic waiting to be seen, or they don't have a regular primary care provider. They're being in the ER for 3 or 4 hours or 6 hours or however long, when for somebody who does have health insurance and has access in their community, it may be a quick in and out visit or a telehealth visit with their primary care provider. But this is just an opportunity to reach people who are overrepresented in those groups of unregistered but eligible voters, and also the people that you're more likely to see within the settings that you practice. I just want to hone in and focus on young voters for a moment, because I'm guessing about half of the people in this call fall into some of those younger age voters. And if you look in New Mexico in the 2022 election at who voted by age group, well, guess what? The older people are making all the decisions about the policies that are going to impact you for decades to come, because 70% of the people 65 and older showed up to vote, and only a third of the people in the 18 to 24 year age group, and similar 34% in the 25 to 34. So again, healthcare settings are a great opportunity to reach young people, and that's just something we're passionate about too, is getting people who literally are going to have decades of living under the policies and issues that people are making decisions about that are going to affect them for a long time to come. So one of the cool things about Vot-ER is, if you sign up as an organization, you can basically track your impact. And so with just a couple of clicks, this was a couple of weeks ago, and at that time we had helped 90 people with the voter registration or voter readiness process through the badges that Health Council, people participating in our Health Council Vot-ER initiative use. And then I just looked this morning, and Kayla, we're up to 99. So probably by the end of this week, we'll have hit 100 people. And I see there's a couple of comments in the chat. Is there anything new, Amanda?
Nothing new. There were responses to the question before.
Okay, great. Thank you. So we're going to pause here just for a second and see how you all are thinking, just based on what you've heard so far. What are your thoughts about integrating voter registration resources into your clinical practice? And don't forget to hit the little blue submit icon once you've made a choice. And I can definitely tell you the times that I have, Kayla and I have presented before to physicians, we get a lot of no ways, too much going on already. So if that's you, we definitely understand. I have yet to get my Alamogordo team participating in Vot-ER, but they're here today, so there's hope. The Las Cruces Family Medicine Clinic a couple of years ago did as a group order badges and decided to use some waiting room posters and things like that. So we are all about join in when you're ready. And if not, we totally understand. We just want to make sure we get the word out. And thank you for responding here. So that's cool. We have no ways today. So before I turn it over to Kayla, just want to, some of you may be wondering, how does a health council do voter education and civic health promotion outreach? Well, this is how we, as a health council, have done our Vot-ER outreach. We've partnered with our community mental health clinic, the counseling center, the New Mexico Department of Health office in Otero County, family medicine residents in Las Cruces. As I mentioned, we've done outreach and training to our Alamogordo team. We also work really closely with the community health worker team at our hospital. There's quite a few of them who have been through the training and wear the badges. And so basically, whenever they're meeting with a patient, whether it's in the community or in the hospital setting, they also have the opportunity, if somebody's interested, to that person can scan the badge and get the information they need to get registered. Kayla's also done a lot of outreach, basically anywhere. She does things that may have nothing to do, that usually have nothing to do with voter outreach. They usually have to do with health education or health promotion in general, whether it's health fairs or community events like the Juneteenth celebration, the Public Health Office open house, the Mescalero Health Fair, the NAACP monthly meeting. We even have you guys on this list already because we knew we were going to be here today. So yeah, basically we take any opportunity we can when we're presenting about this topic in particular, like today, or when we're just out and about in the community. I know my badge has been scanned in grocery stores. It's been scanned in waiting rooms when I'm waiting to see my healthcare providers by other people sitting in the waiting room, like, oh, what's that on your badge? Vot-ER makes it easy and accessible to do this kind of outreach. And then I had made this slide to give Kayla a shout out because she was recently recognized with the Making Democracy Work Award by the League of Women Voters of Southern New Mexico for the outreach she's done with Vot-ER. So thank you, Kayla. And before I turn it over to Kayla, we did want to just take a minute and think, this is thinking broadly now, not just about civic health or not just about Vot-ER, but in your own community where you live and work, who are some of the partners or organizations that you are involved with outside of your clinic? We'll take a minute to hear from. All right, we got Department of Health, a couple of people involved with church groups, Health and Human Services. Anybody else want to chime in? Food pantries, church Rotary, me and NMSU, DHS. Anybody else? And if you don't want to type, you can come off mute and just share. If not, I will pass it to Kayla to give you some other ideas.
Thank you, Holly. So in the next couple of slides, we have examples of organizations and events you can get connected to or involved with to collaborate. First, I'll start with some background information on health councils if you are unfamiliar with it. So New Mexico is one of only 8 states that have a centralized statewide health department. This means that health councils play a crucial role in community-based health assessments, planning, and action at the local level. This is important, especially for communities that have significant health disparities due to inequitable resource allocation and inadequate public health policies. Health councils are like the liaison between the community and state and government entities because we listen to, communicate with, and engage with diverse communities. We also review and assess local data and consider the root causes for those disparities. And with that, we help plan community-focused solutions to improve and advance health equity. Lastly, we advise local and state government on policies that would improve our community's health. So in the previous slide, Holly touched on the numerous ways we as a health council have integrated civic health into our work in various settings. So participating in health councils gives you a bird's eye view of what is going on in your community and provides opportunities for collaboration and establishing relationships with community members. Next slide, please. All right, next up we have the 100% New Mexico Initiative, which is a program of NMSU's Anna H8 Institute, which facilitates a collaborative process in each county to transform under-resourced communities into fully resourced environments. This initiative, inspired by the book 100% Community, Ensuring 10 Vital Services for Surviving and Thriving, aims to create local access to essential services by integrating 10 service sectors into a seamless system of family services. So by addressing adverse social determinants of health, such as lack of access to medical and behavioral health care, the initiative seeks to improve quality of life and prevent issues like adverse childhood experiences, trauma, substance use disorders, and poor school achievement, ultimately reducing the need for family involvement with child welfare, law enforcement, courts, and emergency room care. This organization has strong community ties and bases its decision-making on data analysis. So the counties highlighted in purple on the right indicate which counties have active 100% initiatives, and we highly recommend that you reach out to them to inquire how you can get involved in their efforts. Here in Otero County, we have a very active 100% initiative called 100% Otero. Next slide, please. So several of the events we participate in or offer support with are 100% Otero-led initiatives, like the Day of Hope event that Holly mentioned briefly, and that was an event that provided services to people who are unhoused. We also supported 100%'s led initiative, the annual New Mexico Point in Time Count, to gain a better understanding the needs of people experiencing homelessness. And then they hosted a housing symposium that the Health Council supported that brought community and subject matter experts together to address the housing issue in our county. So locally, our Alamogordo residents have been involved in several of those community initiatives mentioned, as well as providing free school sports physicals at our school district summer block party. And so the great thing about civic health promotion in community settings is the flexibility of where you can do it. We attended our local public health office open house, like Holly mentioned. We just attended a child abuse awareness fair this past weekend. And then we've attended the past 2 years of the local Juneteenth celebration, which is hosted by a community coalition. And each time at these events, we were able to weave in civic health into the conversation. So each event is an opportunity to engage with diverse populations or individuals, thus an opportunity to reach more people you may not see in your clinic. So linking with community-based organizations like health councils or the 100% initiative will expand your reach. Thank you.
Thank you, Kayla. And before we move on from this slide, I just want to give a shout out to our Alamogordo resident physicians, because there's so many of these events that you see on the page, and in fact, their picture on the page, but they are such a crucial part of many of the community outreach and support, not just health services, but that community support and that being out there in the community and making family medicine visible, making themselves visible. And so, yeah, just shout out to my Alamogordo doctors who are on the call. We appreciate you. And as of this morning, just before we got on the Zoom, 55,578 people so far nationwide have updated their registration info or registered to vote through the Vot-ER initiative. And that is very much primarily driven by physicians like yourselves. Kayla and I and our public health people and our community health worker teams were sort of the late joiners, and the, as I mentioned, the physician adjacent or the healthcare adjacent side of things. But this is, you know, just talking about making an impact, and this is an area in which you all have such an incredible opportunity to impact people's lives beyond whatever it is, the healthcare reason that you're seeing someone in your clinic is just to give them the opportunity. And again, you're not registering anybody to vote. You're not turning in papers or guiding them through the process. You're just simply making it easy and accessible through QR codes, through flyers, through other resources like that. And if you, at the end of this presentation, have decided that this is something you would like to do, or you would like to bring to your clinic, anybody, whether you work in a clinical setting or not, you can hop on this vot-er.org/badge link. Takes about 30 seconds, and you can order your own badge as an individual, and you'll be able to, you know, you'll be able to track your impact that way. You can also sign yourself up as an organization if anybody is interested in, you know, like if the Primary Care Training Consortium wanted to organizationally sign on to Vot-ER, you could absolutely do that. Or you could just, as an individual, order a badge without going through, you know, without getting organizational support or going that route. So if any of you all are interested, they make it really easy, and it shows up in the mail for you about 2 weeks later.
Holly, just
Yes.
real quickly, in the chat, somebody said, we appreciate you too, Holly. So.
Oh, oh, thanks. Yeah, we have, I'm so grateful for both the opportunity to have to work with Kayla on so many things. And then this is, I think I've been with the Alamogordo residents since 2021. So yeah, so, and I'm just so grateful for that, that connection and that opportunity to be part of all that they bring to our community. So with that, we'll sort of turn the presentation off in a minute. I have a couple other, if anybody has questions, I have some links pulled up if they're Vot-ER specific, but we would love to hear from you. Either if you want to email us or contact us individually, of course, we always welcome that, but we'd love to, Mario and Amanda, if it's okay to just come off of screen share and talk and see if people have questions and ideas, because so much of what we do has often been informed by somebody saying, oh, have you thought about doing that? Or, you know, what about whatever it is? And then we integrate it into the things that we do. So we'd love to hear your thoughts, both on the clinical side or just on the community in general side. So I'm going to stop screen share. And yeah, questions, comments, ideas.
I guess I can go ahead and kick us off with the questions. In terms of feedback, what sort of feedback have you gotten from physicians that have joined Vot-ER, just with regard to maybe like interacting with their patients and asking them to register to vote?
So I'll start, Kayla, and then if you want to chime in with what you remember from the fellowship. Most of the feedback we've gotten from physicians was physicians nationwide who were part of that fellowship group with us. There's about 100 people that participated in the fellowship, and we were, I believe, the only 2 non-clinicians. They had some nurses, but for the most part, physicians. And what we heard from people was it was one of the most empowering and enjoyable and rewarding parts of their day, just because, when you're talking to somebody, usually they're in your office because there's a problem, right? And oftentimes those problems are not easy to solve in that one visit or through one, whatever the clinical response is. But there's a lot of things in people's lives that can be improved by them getting out to vote. So what we've heard, and we did hear some frustrations too, like, oh, people don't want to talk about voting in the office. That's why it's designed to be a non-interruptive process. If, kind of like, can we talk about voting for a minute? If somebody says no, hey, move on. Like, okay, great. Let's get your appointment scheduled. See you next time. But it just gives you the opportunity. And again, many people have never been asked, so they're grateful for that. It's easy. And so what I remember hearing from physicians in the fellowship was that it was just a cool highlight of their day, because it was a couple minutes interaction where somebody could leave feeling like they had a way to participate now, or they had a way to have their voice heard. And even in the case, they have some great like training videos and scripts, like, what if you bring up voting and your patient either says, well, they confide in you that they're undocumented, or they may just say like, well, I can't vote. What do you do then? Some great tips. And we'll then have a conversation about, great time to be talking to your friends and family about the issues that mattered most, and get involved in, you may not be going to the polls, but you can definitely go to your school board meeting or the city council meeting, or talk to your friends and family who are voters, and make sure your voice is heard that way. So things like that. But I think overwhelmingly, what I remember hearing was just that people were grateful to be able to have such a positive impact in literally sometimes 30 to 60 seconds. So Kayla.
Well, honestly, I would just echo everything you just said, because that's what I remember. And one thing about the Vot-ER initiative is that they're very receptive to feedback, and you can see that in how they modify their tools, because the training video playlist, that wasn't offered when we were fellowships, that came after. And so they're just always updating things. They have constant like advisory calls to gather input from alums and whatnot. So I think the fact that they're just so open to feedback from physicians, from public health professionals, really contributes to that positive feedback that Holly was alluding to.
Excellent. Thank you.
And Holly and Kayla, there's a comment in the chat. It says, thank you, Holly and Kayla. Great presentation and 100% aligns with the public health framework and essential services. Thank you for all you do for Otero County and New Mexico. And that was by John Kutnak.
Yes, and it's so good to see you, Amanda. And Holly and Kayla, I saw this on my Instagram, so I had to join in. I've worked with New Mexico Primary Care, full disclosure, training consortium, helped work to get the residency in Alamogordo. So glad to see it's so successful, and for coming to Department of Health. So I just wanted to say all of this really aligns. Really, if you hear physicians like Dr. Andazola talk, you only spend so much time on the medical side, right? There's so many other factors that affect our patients' health. So I think at any time you could have these conversations, we're all asking and screening about the social determinants of health, right? But I realize as physicians, you have burdens. You've got to see patients. I remember having to beat up the residents and about blocking charts. I don't even want to go there today, right? But have you completed your documentation? So I think this is important, but I think it's also important to, when you are practicing, to be proactive and develop processes within your practice, whether you're in solo practice, working for an FQHC, on how you as a physician can do a warm handoff, whether it's to a medical assistant or to a social worker, if you're lucky enough to have a social worker in your office, that can, if somebody does say, hey, I'm interested in voting, right? How do you help them make that change, right? And then also, you know, it's also the same goes for somebody saying, hey, you know what, I have trouble paying the bills. I've had trouble with food access. You know, the social drivers of health are just so important. And that's why I attached the essential public health services. If you guys, I'm sure you've seen the document, but I think it's a document that as a public health person, I try to live by, right? Because we touch on a lot of those essential services in the work that we do every day, whether you're a clinician or a non-clinician. So anyway, thanks for obliging me. Sorry to be on a rant, but I'm passionate about this. I think this is great. So, and good to see everyone.
Thank you, John. It's always a pleasure to see you.
Yes, thank you, John. And I was getting a little worried until I saw that you had a comment in the chat. I was like, wait a minute, like, I don't think I've ever been in a meeting with John where he hasn't had a question or something to share. So my world is back in balance now that you've chimed in. So thank you. And yeah, and I'm so grateful you joined in today, John. We appreciate it.
Thoughtfully listening. I think that this is so great. So no, thank you guys again.
All right. Any other questions? All right. If we have no other questions, Holly, Kayla, do you have any final thoughts you want to share with the group?
Go for it, Kayla.
I was waiting for you. One thing that I always like to emphasize whenever I have the opportunity to talk about civic health and really applying the Vot-ER initiative into the community, and really based off my experience from being in the community, is that it's really about relationships, building those relationships with people. Because sometimes, even if they don't scan my QR code, or if they don't take a flyer that we created, I'll spend a lot of time just talking to people and really advocating for civic engagement. And that means sitting there and listening to their life story and trying to find opportunities in the conversation to advocate. But it's a great way to really work on building relationships and establishing those in the community. And like Holly was saying, a lot of those conversations inform our strategies, inform our tactics, and expand, you know, how we see civic health. So even if you just have a candid conversation with somebody, that is very rewarding, and it really does go a long way. So I think just bringing your authenticity to the conversation and really just being nonpartisan and being passionate about giving everybody the chance to use their voice, no matter what political party you affiliate with, I think that's where you're going to be the most successful. Is that we all believe that this is just something that everybody deserves to have the chance to do. And so if you bring that authenticity, that's what's going to shine through, and hopefully people will, you know, stay around and talk to you a little longer, or scan the QR code or take your flyer. But that's one thing I'd like to leave with people after these kinds of presentations.
Thank you, Kayla. And that just reminded me of, like, and there's nobody better in the physician world. There's nobody better about that whole building relationships and having conversations with people about things that matter to them than family medicine physicians. So it's kind of that fits right in with just thinking about the family medicine physicians I have the privilege of working with. That's, you know, there's so much already that they do day in and day out that's just about building those relationships and being that space where, you know, where people can bring their authentic selves. So you all do that every day already, is bringing your authentic self to your clinic and to your patients and to your community. And this is just one more way to do that. And
all right. Well, if we have no other questions, we'll go ahead and close out for today. Thank you again, Kayla and Holly, for that great presentation. And with that said, thank you very much for joining us today, everyone. Have a great rest of your day.